Today, we're going to talk about a health check that is just so important for so many of us, cervical screening. You know, it's genuinely one of the best tools out there for preventing a really serious disease. So, over the next few minutes, we're going to walk through the whole thing, step by step, to make it super clear and hopefully a lot less intimidating. So, let's start with a question that gets right to the heart of it. What if there was a simple test that could actually prevent a cancer from ever happening in the first place? Well, that's exactly what cervical screening does. There's this huge misconception that it's a test for cancer, but it's not. It's a test to stop cancer before it even has a chance to start. And this right here, this is so critical to get from the get-go. Seeing the word abnormal on a result can feel, really scary. But with cervical screening, it almost always just means the system is working perfectly. It's found a little something early enough that it can be dealt with, usually very simply. Okay, so let's dig into why this simple test is such a powerhouse. Just take a look at this number. In the UK alone, cervical screening is estimated to prevent more than 4,000 cases of cervical cancer every single year. I mean, that's thousands of people who are protected, all thanks to this one proactive health check. It's huge. Now, you might be thinking, but what about the HPV vaccine? And that's a great question. The vaccine has been a total game changer for sure, but it doesn't protect against all the high-risk types of HPV. The best way to think about it is like this. The vaccine is your shield, and the screening is your essential backup plan that makes sure absolutely nothing slips through. They work together as a team.
All right, let's pull back the curtain on the test itself, because honestly, just knowing what to expect can make all the difference and take a lot of the worry away.
So what are they actually looking for? Well, the test is kind of a two-part mission. First, it checks for the main cause of cervical cancer, which is high-risk types of the Human Papillomavirus, or HPV. If that's found, then, and only then, they look at that very same sample to see if there are any changes to the cells of the cervix.
So let's get our bearings. The cervix is right at the top of the vagina. It's basically the neck of the womb. And the entire procedure is just about collecting a tiny little sample of cells right from that surface, so they can be looked at under a microscope. It's very targeted.
You can really break the whole appointment down into 3 super simple stages. First, preparation. You'll get some privacy to undress from the waist down. Then, position. You'll lie on the examination couch. And finally, the procedure itself, which honestly only takes a couple of minutes. That's it. And these are the only 2 tools involved. A speculum, which looks a bit like a duck bell, is gently put in to help the nurse or doctor see the cervix. Then they use a tiny, very soft brush to just lightly sweep the surface and collect the cells. That's the whole thing. No needles, no cutting, nothing like that.
Okay, so you've done the test. A few weeks later, a letter arrives. Let's break down what the results actually mean, because sometimes the wording can be a little confusing.
So first things first, let's just talk about HPV. It is incredibly common. Most people who are sexually active will have it at some point in their lives. And here's the key thing. For the vast majority of people, your own immune system just gets rid of the virus all on its own, usually within 2 years, and it causes no problems at all. So your result will tell you one of 2 things right off the bat. The most common result by far is HPV negative. This means no high-risk HPV was found. Awesome. You just go back to your normal routine screening in 3 or 5 years. If the result is HPV positive, all that means is it's time for step 2, taking a closer look at the cells from that same sample. Now, even if you test positive for HPV, it is very likely that your cells will look completely normal. If that's the case, the plan is simple. You'll just be invited back for another test in a year's time. This basically just gives your immune system the time it needs to do its job and clear the virus, which, again, it usually does. Now, if they do find cell changes, you'll see a word on the report, dyskaryosis. I know, it sounds a bit technical and scary, but let's be super clear. This is not cancer. It's just a medical term for precancerous changes. Most of the time, these changes are borderline or mild, and they often just go back to normal by themselves. Moderate or severe changes just mean that treatment is probably a good idea to prevent any problems down the road. So what actually happens if you get a result that shows those cell changes? Let's quickly walk through what that follow-up looks like.
You'll be invited for a colposcopy. Now that word can sound intimidating, but it's really just a closer look. Think of it like a pair of binoculars for your cervix. It uses a special microscope, which stays outside your body, to get a magnified view. It lets the doctor see everything in detail. They might take a tiny pinch of tissue, a biopsy, to confirm the grade of the changes. But the main thing to remember is this is all still part of the prevention stage.
Okay, to finish up,
Let's quickly hit on a few of the most common questions that people have about the whole screening program.
This is one we hear all the time. If this test is all about prevention, why on earth do we wait until age 25 to start? Well, it's a great question, and the answer is all about balancing the benefits against any potential downsides.
You see, research has shown that in people under 25, harmless cell changes and HPV infections are incredibly common, and they almost always clear up by themselves. So if we screened earlier, we'd end up causing a lot of unnecessary anxiety and doing treatments for things that would have just gone away on their own. Age 25 is really the evidence-based sweet spot where we start catching the things that matter without over-treating the things that don't.
This question is so important because it gets to the heart of who screening is for, and there are a lot of myths out there that need clearing up.
The answer is a clear and simple yes. Screening is for everyone with a cervix, and that's because HPV can be passed on through any close, skin-to-skin sexual contact. That includes touching or sharing sex toys. It's not just about penetrative sex. That's why the recommendation is for everyone with a cervix, no matter what your sexual history or identity is.
And that really brings us to the bottom line. When you boil it all down, what are we talking about? A test that takes just a few minutes of your time every few years. When you weigh that against its incredible power to prevent cancer, well, the choice for your long-term health becomes pretty clear. Thanks for joining me for this explainer.